90% of seniors tragically miss the subtle warning signs their body sends weeks, sometimes even a month, before a major stroke strikes. These aren't the obvious sudden signs like a drooping face or a weak arm. These are quiet whispers, easily dismissed as normal aging or everyday aches and pains. But ignoring these early signals could cost you everything. I'm Dr. Miles, and today, on Senior Forward Health, I'm going to reveal these 7 hidden signals of a stroke before it happens. We'll explore why they're so often overlooked, and most importantly, I'll empower you with the life-saving knowledge to recognize them and act decisively to protect yourself and your loved ones. It's easy to feel overwhelmed by health concerns as we age. The fear of a stroke, a brain attack, is very real, and understandably so. Many people know that a stroke occurs when the blood flow to a part of the brain is interrupted, leading to the rapid death of precious brain cells. But do we truly grasp the urgency? Think of your brain as a vibrant, bustling city, constantly powered by a network of roads and electricity. A stroke is like a sudden blackout, cutting off power and communication to parts of that city. Within minutes, brain cells begin to die because they are starved of oxygen and nutrients. Approximately 1.9 million brain cells die every single minute a stroke goes untreated. This staggering number highlights why every second truly counts, and why early recognition is not just important, but life-saving. There are 2 main types of stroke. The most common type, making up about 87% of all cases, is an ischemic stroke. This happens when a blood clot blocks an artery that supplies blood to the brain. Imagine a major highway suddenly getting blocked, stopping all traffic. The second type is a hemorrhagic stroke. This is less common but often more severe, occurring when a blood vessel in the brain bursts and bleeds into or around the brain. This is like a pipe bursting and flooding part of our brain city. Regardless of the type, the outcome can be devastating if not treated immediately. Before we dive into the earliest, most subtle whispers, let's understand the landscape of stroke risk. Many factors can significantly increase your chances of experiencing a stroke. While we can't change our age or genetic predisposition, we have immense power over many of these modifiable factors. These are often the familiar foes that silently erode our health over time. First, high blood pressure, also known as hypertension, is the leading cause of stroke. It's often called the silent killer because it usually has no obvious symptoms, yet it constantly damages your blood vessels. Diabetes is another significant risk factor, as high blood sugar levels can damage blood vessels throughout your body, including those in your brain. High cholesterol contributes to atherosclerosis, a condition where plaque builds up in your arteries, narrowing them and making them prone to blockages. Smoking and vaping are incredibly damaging to your blood vessels, accelerating clot formation and raising your blood pressure. Quitting smoking is one of the most impactful changes you can make to lower your stroke risk. Obesity and being overweight are linked to high blood pressure, cholesterol, and diabetes, all of which increase stroke risk. A sedentary lifestyle, or physical inactivity, contributes to these other risk factors. Aiming for at least 150 minutes of moderate-intensity aerobic activity each week can make a huge difference. An unhealthy diet, particularly one high in saturated and trans fats, sodium and sugar, also plays a major role. Choosing a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, like the Mediterranean diet, is highly recommended. Excessive alcohol consumption can raise blood pressure and triglyceride levels, further increasing your risk. And chronic stress, while not always thought of as a direct physical threat, can contribute to unhealthy behaviors and sustained high blood pressure, silently chipping away at your resilience. Another critical modifiable risk factor is atrial fibrillation, or AFib. This is an irregular and often rapid heart rate that can cause blood to pool and form clots in the heart. These clots can then travel to the brain, causing an ischemic stroke. Managing AFib with your doctor is absolutely essential for stroke prevention. Understanding these familiar foes is the first step in building your fortress of health and reducing your risk. Now, let's talk about the body's more urgent warning signals, often referred to as a shout before a full stroke. This is a transient ischemic attack, or TIA, commonly known as a mini-stroke. A TIA occurs when blood flow to the brain is temporarily blocked, causing stroke-like symptoms that usually resolve within a few minutes to an hour. These symptoms can include sudden weakness, numbness, difficulty speaking, or vision changes. Crucially, while TIAs do not cause permanent brain damage, they are a strong predictor of a future stroke. Many people make the mistake of dismissing a TIA because the symptoms disappear. They think, "Oh, it was nothing, I'm fine." But a TIA is anything but mini in terms of its warning power. It's your brain screaming for help, telling you that a more severe event could be just around the corner. About half of all strokes that occur after a TIA happen within just 2 days. This means any TIA symptom requires immediate emergency medical evaluation, even if the symptoms have completely disappeared by the time you seek help. When these sudden, more obvious signs of a stroke or a TIA appear, there's a vital tool to help you recognize them quickly and act decisively. This is the F.A.S.T. acronym. It's easy to remember and could save a life. F stands for face drooping. Ask the person to smile. Does one side of their face droop or is it numb? Is their smile uneven? A stands for arm weakness. Ask the person to raise both arms. Does one arm drift downward or feel weaker? S stands for speech difficulty. Is their speech slurred? Are they unable to speak, or are they hard to understand? Ask them to repeat a simple sentence, and T is the most critical. Time to call 911. If you notice even one of these signs, do not hesitate for a second. Call emergency services immediately. Even if the symptoms resolve, it is still a medical emergency. Do not drive yourself or the person to the hospital. Let the paramedics come. They can begin life-saving treatment on the way and alert the hospital's stroke team, ensuring rapid evaluation upon arrival. Remember, with a stroke, time is brain. Other sudden symptoms that warrant immediate emergency attention, beyond F.A.S.T, include a sudden loss of balance or coordination, sudden trouble seeing in one or both eyes, or a sudden severe headache with no known cause, often described as the worst headache of my life. Now, let's get to the crucial information that 90% of seniors miss. Even before a TIA or the F.A.S.T signs appear, your body might be sending even earlier signals, subtle whispers that can show up days, weeks, or even a month before a major stroke. These are incredibly easy to overlook because they often come and go, or seem like minor inconveniences that we attribute to normal aging. But for those with existing stroke risk factors, recognizing these whispers could be life-changing. It is absolutely critical to pay close attention to any new, repeated, or worsening changes in your normal state. These are not always clear-cut, which is why they are so often missed. Let's delve into 7 of these subtle pre-stroke warning signs. 1. New or changing headaches. This isn't just any headache, but one that's unusually severe, comes on suddenly for no clear reason, or changes significantly from your usual pattern. For instance, if you normally get mild tension headaches, and suddenly you experience a blinding, pulsating headache unlike any you've had before, or your regular migraine suddenly feels different, more intense, or occurs with other odd symptoms, this needs attention. Don't dismiss it as just a headache. 2. Fleeting numbness or weakness. This refers to brief, temporary tingling, numbness, or a slight feeling of weakness in your face, one arm, or one leg. Imagine a sudden pins and needles sensation that vanishes in moments, but then reappears later that day or week. It might be so mild that you barely notice it, or you might shake your arm and the feeling goes away. The key here is the fleeting nature and the recurrence. If it comes and goes, especially affecting only one side of your body, it's a significant warning. 3. Brief dizziness or imbalance. Short moments of feeling dizzy, lightheaded, or suddenly losing your balance can be a whisper. You might feel a sudden sway, a brief sense of vertigo, or find yourself momentarily unsteady, especially when standing up. This is not just getting older clumsiness if it's new for you and repeated. If you suddenly find yourself needing to grab onto things to steady yourself more often, or feeling a general sense of being off balance that wasn't there before, pay attention. 4. Temporary speech difficulties. This could manifest as fleeting trouble finding words, slurring your speech ever so slightly, or stumbling over words. You might be mid-sentence and suddenly forget a common word, or your tongue feels a bit thick for a few seconds before returning to normal. Others might notice you're momentarily harder to understand. Because these moments are brief and resolve quickly, they are often brushed off as simple fatigue or a senior moment. But if these occurrences are new and repeated, it could be a warning sign. 5. Transient visual disturbances. These are sudden, brief, blurry vision that quickly clears up, seeing unusual flashes or dark spots in your field of vision, or temporary double vision. One moment your vision might blur as if a camera lens is out of focus, then it clears. Or you might see a brief, unexplained flicker, or a sudden shadow that passes quickly. If these visual changes happen suddenly, in one or both eyes, and then resolve, they are significant. This is more than needing a new pair of glasses. It's a transient disruption to your brain's visual processing centers.